Good evening. I am Anil and I welcome you all to the second event of India March for Science 2021. This event is titled The Role of Science and Scientists During the Pandemic. It's a panel discussion on the experiences of scientists associated with the Indian scientists' response to COVID 19. And in short, it is ISRC. ISRC is a unique initiative by Indian scientists in the face of the present pandemic. To the best of my knowledge, this is unique in the world. It started with some concerned Indian scientists coming together voluntarily. It now has more than 500 scientists, engineers, technologists, doctors, and public health researchers, science communicators, journalists, and a number of students. All these people are affiliated to eminent research institutes of science and technology, universities, colleges, hospitals, and private laboratories. The group also includes Indian scientists from laboratories all over the world. We are very happy that two of the initiators of ISRC, Dr. Reeteka and Professor R. Ramanujam, are with us on the panel today. Our first speaker is Professor R. Ramanujam. Professor R. Ramanujam is a theoretical computer scientist and science communicator who has been associated with the Institute of Mathematical Sciences, Chennai, and Tamil Nadu Science Forum for a very long time. I now request Professor Ramanujam to talk to us on his experiences working with ISRC. Over to you, Professor Ramanujam.
Thank you very much. Good evening, everyone. Can you see my screen? Okay.
Yes.
Okay. So I have titled my presentation as "Scientists as Citizens: Lessons from the Pandemic." So, as Anil mentioned, the way it came together. So let me take you back to Sunday, March 15, 2020. The news of we're just having news of campuses being shut down. In my own institute, there was a decision that all students should vacate the campus by March 22, and people were hesitating, saying, should we do this? Tamil Nadu announced that schools and colleges would be shut as of date. Board exams came to a halt, and that created a lot of tension. And I was in an auto rickshaw on March 18th going to Anna University or coming back. And one worried auto rickshaw driver was telling me, sir, in Tamil, lockdown they're going to shut down everything. So we'll all be out of business. So you people, so he meant scientists, should work double time to make sure that the problem goes away fast. And I thought it was a fair demand, right? I mean, this is what scientists should be doing when it was a natural concern for him that he was going to lose business. And little did we know at that time that this was something that may take years, and 1.5 years after that, and the pandemic is still with us. March 19th, the very next day on Thursday, there was a discussion among some of us that scientific institutions have to do outreach on COVID. This is a virus, this whole thing is based on a virus, 360 base pairs. And how is the public to understand what the problem is? And, there is an email to a set of 10 scientists proposing that we form a group of scientists, individuals, stressing the need for a voluntarily built platform. And the idea was that it should signal to the scientific community itself that it has a social responsibility in a time of crisis like this, to signal to the government at various levels through the media, and very crucially, provide scientific resources for people's groups who would become active on the ground necessarily in the coming weeks. Even at that time, we were talking about a few weeks, a few months of effort. That's what we were talking about. March 22, on Sunday, this was the Bartan Banging Day. Like April 5 was the lamp lighting day that the country went through, by which I don't know what energy was going to be used to fight a pandemic. And we had a rudimentary website, and a Google group was started. Within 2 days, we had about 160 members. As Anil already mentioned, they came from different groups, and it was all word of mouth, writing to friends, asking. And there is tremendous enthusiasm on the part of scientists who came together, and we formed groups like Hoaxbusters. There is a spelling mistake there. Science communication, resources in Indian languages, apps development, mathematical models. And by April 15th, we had, in a month, we had 700 members from almost all S&T institutions in India, all IITs, and many labs from around the world. Many concerned Indian scientists were participating. There were, like Anil mentioned, also designers, journalists, and a few artists, and very few social scientists. Now, ISRC had very rich interaction with the media. Over the period April to July, many newspapers and online platforms reported on ISRC. We had regular interaction with the Indian language media in Marathi, Tamil, and Bangla, to some extent in Kannada as well, I remember, but much less. We had interactions with the government. We had interactions with people from Niti Aayog. We had people from the Principal Scientific Advisor's Office, and we kept them informed of what we were doing. We tried very hard to interact with state governments with varying success. We had many interactions with people's activist groups, especially the All India People's Science Network. In fact, the Swaraj Party formally used ISRC material in its pamphlets. Now, for many ISRC members, this was the first exercise in public engagement of a large kind. The science-based cause of this crisis provided an impetus for scientist participation. And the process of science was evident. I mean, there were like heated discussions. There was a lot of uncertainty about, in fact, at the beginning, there was also about the mechanism of how the virus spreads. We didn't give much emphasis to airborne transmission. We were mostly talking about droplets and then the need to clean surfaces and so on. And there's a lot of uncertainty about drugs, what drugs might be used. And we never expected that vaccines would be available very quickly. And with publications as they came, discussions on them and how to communicate that to the public, and also the kind of misinformation that was coming later. I think Reeteka will talk more about that. The closure of S&T labs during this period clearly cost the country dearly in its preparation, because many scientists would have loved to go to their labs and do some work, but this energy could have been channeled into much needed preparation. The fact that there was no comparable initiative from our large university system, and I'm only talking about the first lockdown period, right? And April, May, June. After July, I know that people in the university system got into online classes and getting into the whole uncertainty and a whole lot of problems. But in the few months, the university system could not gear up itself to do science communication, and this is something that we should cause reflection among us. Now, we got a lot of lessons in public engagement with science. The tremendous disconnect between the state, scientific bodies, field activists, and the general public. The massive need for scientific material in Indian languages, and the tremendous demand for that, which we do not address in general at all. And that there is really no alternative to direct involvement by the scientific community when it comes to engaging science with the public. And that science communication should be a part of the mandate of our institutions and not something peripheral you do only in times of crisis. Let me just take one more minute to stop sharing. And I'm going to show you just a little bit of the website so that you can also get an idea of the, oh, I'm sorry, just a moment. Sorry. Okay, not getting the screen. I get only the entire screen. Okay. Are you able to see the ISRC website, or I'm not able to see what you see on the screen, or is it a mess? Let me stop share and try again. Sorry to waste your time. Just give me a moment. I'll try again. Now I can see. Yeah. Okay. Now you should be able to see the ISRC. So you can see that. Can you see the Anil, can you see the
Yes.
ISRC
Yeah.
slide?
Yeah.
Okay. So there is this thing called for public, and where you have busting COVID-19 hoaxes, Q&A on COVID-19, daily life in COVID-19, where there is mental health, hygiene, household at work, several such things. And then for the scientists and healthcare professionals, whole lot on mathematical modeling, what modeling is about, explaining models, modeling resources, data analysis, and then these things called ISRC discussions. And we had a whole lot of events. What I want to stress is the fact that if you look at the material, you will see that Assami, Bangla, English, Gujarati, Hindi, Kannada. So in 18 languages, right? The following 19 languages, including English, right? That this was one of the major strengths, I must say, of ISRC. And even if we go to the thing on events, you will find that all ISRC events, among them, whole lot of things that you will see which are on ISRC events. You will see that, here you can see, in Gujarati, in Malayalam, in Kannada, in Hindi. So, and then here is something on Tamil, interaction with media persons. So this interaction is one of the important lessons that we learned from ISRC that I wanted to communicate with you. Thank you very much for this opportunity. You will hear more about different aspects of ISRC work from my colleagues. Thank you very much.
Thank you very much, Professor Ramanujam. Our next speaker is Dr. Reeteka Sood, who works at NIMHANS as a research coordinator at the ADBS lab. The lab tries to understand the basis for mental illnesses using stem cells derived from patients. She also has a strong interest in science communication. Today, she will speak to us about the process and her participation with the hoax busting team of ISRC. Over to you, Dr. Reeteka.
Thank you. Thank you again for inviting me. So, yeah, I wanted to start with just giving the these are the two emails that are still active with the group. One is specific to hoax busting. Here we had, this was started at the beginning of the, when we were just getting into the hoax busting team was finding its ground. So we had set up a separate email. This is where people, when they hear something, if they want to confirm whether there is any truth to some things, they can email us here. And this, of course, is the general email for the group. This is the page that Ramanujam had just showed, the details of all the hoaxes that the team, the evidence that we put together against those to finding this evidence, to grade them against the evidence available. So these are some of the people that were that I have been working with.
Dr. Reeteka, just sorry to interrupt you. Your screen is not visible. Could you check again?
Okay. It says.
Yeah,
let me
now
start.
Now it's visible. Yeah.
It was okay. I'll start.
It's gone again.
I thought I'd stop and start again.
Yeah,
One
okay.
second.
Okay.
Now is it okay?
It's coming on. Yes. Now it's on.
Okay. All right.
Yeah.
So yeah, these are some of the people that are part of the team. I say some because there is a lot more, and I have included the link here for others who the whole list of people here. And so I want to start with just the sort of chunks of what the process was and how we did. So essentially, we started with collecting hoaxes. This is anyone in the team, what they have heard through their social media feed and WhatsApp in particular. And like I said, there was also the email that was open to the public to send us whatever is currently circulating. Once we have a list that we're going to address, then we would collate the evidence. So this is something that all scientists, this is part of our training. So this was a good opportunity for us to put our subject-specific training, but put it to a larger use. So, and here we made sure that we steered away from news sources as much as possible, because and this is still true, that the information we're learning about it as we go. So we wanted to make sure that whatever information we put out there was based on the best available scientific evidence, and so source matters. So there we wanted to make sure that not only that the information is current, but also there was intense discussion about, does the evidence hold true? We don't want to say it just because somebody else published it or it's a preprint, but then does the evidence and claim match? This is part of what we learned to do in our training, and we wanted to make sure that we collectively put it to good use. And so once we have, this is the claim and this is the evidence against it, we want the next step was then to summarize the current evidence. Now this is where sometimes our scientific training gets in our way, is that we get used to a certain jargon, and it's comfortable when you're within your own small group or within the lab, but then outside of that it can present a challenge. So the point is to not only summarize the best evidence available, but also to do it in a jargon-free manner. And then this part is where we had the help, fortunately, of a lot of artists who volunteered their time, and we helped us present the evidence in a WhatsApp shareable format. That was very important to do, because WhatsApp is the medium through which mostly hoaxes, myths circulate. So it was important that the evidence uses the same route. So I'll share a couple examples of, for example, here, this one claim that said steam inhalation can cure infection. So based on the evidence that we discussed, the verdict was that it is not true. It cannot cure the infection. And so on the WhatsApp shareable format, we summarized what the evidence was, in terms of why do we say, why does the claim and the verdict not match in this case? Another case where the claim was that air purifiers can protect from coronavirus. Based on the evidence, the verdict was that the claim is misleading. It's intentionally or not, but the claim is worded in a way so as to confuse. I mean, there is filters and they can prevent some particles from coming in, but there was no evidence to say that coronavirus was one of those things. So it's misleading in the way that it is worded. I'll take one specific example where I go into more details of the way the website, the information is organized on the website. So here in this case, the claim was drinking hot tea can protect against novel coronavirus. Now here, the verdict is most likely false on the account that there's not enough evidence. So again, we have a summary here that, I mean, when you have a cold, it feels better to drink something hot like tea. But then it is very specific to say that something is preventative or it has curative powers. It's a whole nother thing entirely. And so why we said it was because based on the evidence, a temperature of 56 degrees needs to be maintained in the throat to destroy the coronavirus. And to drink something like tea, it's just not possible to have that temperature sustained in the throat for that long. And though it has some compounds like flavins, but then there is no proof that they destroy the virus inside the body. And so we have a brief response, and this is true for every hoax that is addressed on the website, that there is a brief response, and we tried our best to have that in a simple language. But then there is more details on the evidence to explain why we say what we say, because a lot of myths will have this thing, a scientist from a famous university said, so it should not come down to, well, my scientist says this, but that one says that. But then we have to explain why we say what we say. So there is a details of evidence here, and then it is followed by a list of references for each corresponding evidence. And in this case, like the first one on the reference list is a paper like this one. And this is why the evidence, the verdict in this particular case was most likely false, is because this study here showed that they tested a whole bunch of compounds and against the virus isolated from SARS-CoV. This is the first SARS virus, not the current one. But there they tested that the activity of one of the enzymes of the virus is decreased with the some of the compounds that are in tea. Now, it's important to understand that this is done outside. This was never tested in any living cell. No lab animal model, no cells, nothing. So this kind of a study is can be a good start towards something big, but then based on this alone, it's insufficient to say that you drink tea and you'll be fine. So this is how we organize to say we wanted the information to be clear, and this is not always easy when the situation is fluid and the evidence sometimes changes so very frequently. So there is the science part of it, but then there's also the science communication part of it. How to even communicate that the situation is fluid? And the answer is we don't know. And knowing full well, and this was used to come up in our discussions a lot, is that human beings do not deal with I don't know situations well at all. So we have to convey that there is an uncertainty about the situation without sounding like we don't know. We don't know because no one knows. So that was always the tussle to say how to present it in the best possible way to make uncertainty part of the equation. So I will use the rest of my time to sort of make a personal appeal here. So one thing, and one of the reasons of doing the hoax busting was that information that is incorrect, misinformation or disinformation is very readily available. It gets delivered to our inboxes or social media feeds without even trying it. But the right information should also be just as easy to find. So that was one of the motivations of going through the motions and putting all this evidence out there in a simple language. But all that said and done, I also want to emphasize here that we live in a world where, facts alone don't matter. Is my screen still visible? Yeah.
Now it's not. Right now it's not. It's just dark.
Oh, what's happening? 1 second. Sorry.
Now it came back on.
Back.
Yeah. Okay. Facts alone don't matter. Yeah.
Okay. 1 second. I want to make sure that I don't hide. Okay. Okay.
Yeah.
So okay. So yeah, the thing is, to this audience here, I think I can comfortably say that this is a group where it matters to us. This is a group that is personally vested in making sure that right information gets out there and people have access to it, and they can differentiate facts from fake. But then we have to remember that facts alone don't matter. And why I say that, I will want to give a couple pieces of evidence to support that. This is a work by a cognitive scientist, Tali Sherrod, and she has done research. So the paper I want to tell you about is how people respond to new information. So this is a study where they have asked people about what they think about climate change. Do they think that human beings have caused it, or do they think that we have nothing to do with it? And based on people's beliefs, they ask them to make a guess of how much do you think the temperature of the planet is going to go up in the next decade or so. So now they have two groups of people. One group believes in human contribution to climate change and one doesn't. And now they mix them, they sort of randomize and mix everybody together again. So now they make two new groups. So each group now has mix of people. Some believe in human contribution to climate change and some don't. And to one group, they say that scientists have looked at the data and it's actually much worse. The temperature of the planet is going to go up by a lot more than what people believe, what they had originally thought. And to the other group, they said scientists have really looked at the numbers and it's actually not as bad as we thought, and it's not going to go up by that much. And given the light of this new information, would you like to revise your guess that you had earlier made on the increase in temperature of the planet? And so this is what we have. We have people's prior opinion, and they're given a new information in which in some cases agrees with what they already think, and in other cases it contradicts it. So how do people react? So you see here, this on the right is people who very strongly believe that human beings are screwing up the planets in unprecedented ways. We are the cause of climate change. So to this group, when they get the bad news, which is this light gray here, which when they're told that it's actually worse than we thought, they revise their opinion, and it's actually more towards so if you imagine a continuum, on one side you have people who think it's worse, we are doing so much harm to our planet. On the other side is, no, we have nothing to do with what's happening. So if on this continuum, if there is somebody who thinks that human beings are causing are contributing to global climate change, when they're told that things are worse, they go more towards the extreme. And on the second side, the left side here, these people who think that human beings are not responsible for climate change, when they're told the good news, well, yes, it's not as bad as we thought, it's only then that they change their opinion, they update their opinion. Only with the good news, nothing really happens when they're given the bad news. So that tells us, so information, when whatever new information we get, we grade that against what we already think. Now remember, I said they were asked people's opinion. Never mind whether the opinion is correct or not. The brain grades everything against what it already thinks. The opinions are already formed. So, and when new information comes in, it actually makes us more polarized. It doesn't fill a gap. It doesn't bring us closer. It actually makes people more polarized. So, so they pay attention only to information that agrees with what they already think, and they ignore the contradictory opinion. So that should be, I think, a sobering thought for any one of us who are vested in making sure that people have the right information. It's not enough that they have the right information. We have to see in terms of how it relates to what they already know. And so really quickly, this is a second study. They wanted to see what happens in people's brain when they get contradictory information. So in this case, they got people into an MRI scanner so they can see the activity of the brain while people are given new information, what they do with that information. So here people were shown pictures of real estates, and they were told the value of that, what that property is worth. And do you think this, the number, its value that it's quoted, is it above or below the market value of this property? So again, asking for opinion, nothing big. And once they asked for their opinion, they were told, well, how sure are you? So then how much are you willing to wager? They were given a range, 1 to 60 or something. And how much are you willing to wager? So a sign of how confident are you in your opinion. And then they were put in the scanner and across a glass partition, so they can see there's another person across the scanner also. And they were given, so a while back when this happened at the second stage, they were again told, these were the images we showed you. This is what you said at the time. And now they can monitor what's happening in their brains. Now at some point, they're randomly told that person across the glass partition, this is what they think. This is their opinion. And
Reeteka, 1 second. Could you finish in a couple of minutes?
Of course. Yeah, that's one more slide to go. Yeah. Thanks.
Sure.
So they were told what the other person thought. Now, and then at that point, when their brain scans are seen, researchers found that when they're told that the other person agrees with them, the part of the brain lights up. So there is activity, the brain is coding information, yes, good, okay, I'm on the right track. But not so much when they're told that the other person disagrees with them. So here we have experimental evidence that the brain ignores any incoming information that does not agree with what any opinion we already hold, and only uses the evidence when it's confirmation, but ignores the rest. Which is not to say that we should not waste our time busting hoaxes or correcting misinformation, but for it to stick, for the correct information to stick, we have to make sure we understand, or this has to be part of a dialogue as to why people continue to believe in misinformation. So, I mean, there is a clamor of information, information, right information, misinformation, which is why I said facts alone don't matter. We have to pay attention to why, the reasons why people choose to believe misinformation when they do. That's it. Thank you.
Thank you very much, Dr. Reeteka. That was very nice, very illuminating. Our next speaker is Dr. Varuni. Varuni is an outreach associate at the Institute of Mathematical Sciences, Chennai. Over to you, Varuni.
Hi. Yeah. So let me just share my screen and then I'll start off. So I'm going to switch gears a little bit and talk about kind of how all of this, what actually we were doing to get all of this information out. Like Reeteka was saying, it was important to look at, primary sources and papers and try and communicate this to the public. But, what we were trying to do was coordinate, just making sure you can still see my screen. Maybe it's taking a second. Okay, good. So, we were trying to do all of this, but we were also trying to do this by coordinating people from all over the country who had also just gone into this lockdown, trying to figure out how to share internet with like family members, devices, what do we do, etc. So I'm going to tell you a little bit about what we ended up doing for this daily life and COVID-19 series. Something very similar, similar kind of workflows were generated by all of the different, subgroups working with in ISRC. But I thought I'll just use this as an example to since there may be science communicators here who do want to kind of coordinate. I can tell you how we did it, what worked, what didn't work, and what we still don't know how to get working. So in English, there's this saying, this idiom, which is, this is how the sausage gets made. I don't know, there must be a Kannada version of it. I asked some Kannada friends, I haven't got anything, but I'm happy to hear a version of it if there is. So this is how the sausage gets made. So what we start with is a README file, right? So it has all this detailed information of, how things move, where they move, when different stages of writing are done, when things go into translation, and, who is responsible for moving it. So these are, I'm sure all of you have seen similar README files for, computer programs and things like that. So it's something that's very similar, but at the end of the day, no one really reads those, right? The only people who read them are the ones who write them, right? So it was mainly for us to understand. So there was a core kind of coordination team, which was about 4 or 5 of us. And so this README file was basically more for us to work out what was going on, because the first couple of weeks are a bit chaotic because no one knew what stage a document was in. Is it ready to go out? Should we translate? Should we not translate? So so this was mainly for us to kind of organize our thoughts more than anything else. It was available to everyone else who was also in ISRC, but this was mainly for us. So just to summarize, this is kind of how it works. So we start with some topic of interest or importance. This is often a suggestion that comes from an ISRC member, or if we see something, if we get forwarded something on social media that we think needs to be addressed. And also just generally, a lot of people, like Jam was saying, from, auto drivers to, your mother is asking you, like, what do you know about this virus? Like, what do we do? How do we, when we bring the newspaper in the morning, what should I do, right? So the questions came from all of these kind of places. So then we sit down and we try and look at what do we know? And what do we know as in what's been published? And like Reeteka was saying, there's also some burden to analyze it, to see whether it makes sense, and also communicate. Like she said, this communication of uncertainty kept coming up again and again in all of these conversations, and it was important to say, see, this is what we know now, and these are the things that we don't know now. So so what we know often came from scientific studies. Some of them were government guidelines, because the other sorts of questions that we were getting or seeing were, what are the guidelines for, cremation workers, for ambulances, things like that. So there were also people looking at, what the government had put out, and like how we can write about that as well. So once we do that, we break it up into these 3 different pieces. So there's some detailed information. So this detailed information is usually for I mean, anyone who's interested to read it, but maybe more kind of science communicators or NGO groups that are going and talking to people. There's this infographic which has some text and some infographic, like some icons and things like that. So that is supposed to be kind of forwardable, similar to what Reeteka was talking about with these hoaxbuster, like, little images that go out on WhatsApp or whatever. And then the last thing that we also did was this story. This was basically trying to incorporate all of the information that we had gathered about what we know about some topic and weave it into a story. So we call these kind of Selvi stories in our circle, because I think the first one Jam started writing, and the character he had was this woman Selvi, who was trying to figure out, she was a caregiver for the house and she was trying to figure out what she should do because her father-in-law was sick. So these stories were kind of nice because, I mean, at least we thought that they would communicate some of this detailed information that may have, that you can look up the scientific basis for if you go into the detailed information section, but it communicated guidelines and contextualized it into people's everyday lives. So once these three are, I mean, obviously all of us were kind of working in English because, that was the common language here. And once all of that was done, there were two things that happened to all of this information. So it went into translation, which I'll talk about a little bit. So we tried to translate a lot of this into as many languages as we could. And then there was a design portion of it, which was also equally important, because we needed, I mean, it can't just be like a PDF of, that looks like a scientific article. There needs to be much more to it. So once that's done, it gets formatted, the translations and design get put together, and then we end up with images and PDFs, and then they go up online, either on social media. So Reeteka actually was managing, Reeteka and some others were managing Twitter and Facebook and Insta as well, I think. And then there was also forwardable media. So there were some WhatsApp groups that we had started, actually language specific groups that were sending out information in particular languages. And then of course all of it was on the website. So if you went to the website, you could download all of it. So I'll just, I mean, so there's a lot of moving parts to keep track of. So we had a lot of these spreadsheets where things were colored. Is it done? What's the next action? Like, what has to happen next? I mean, these were obviously these were all open to everyone in the group. But again, I think it was more for us to figure out, where we are at, because it became very quickly very hard to keep track of what was happening, because there were 50 people working on 10 different documents, and you don't know where you are at. So the writing part, we had a little, so for each part we had a little bit of guidelines for people who were writing. So you take stuff, you write stuff, you try and put in primary sources, and then we had a vetting process, which was usually a scientist or someone who is a biologist familiar with the field to kind of look at it, and so not necessarily a biologist. For example, the one we did on masks, we had a physicist kind of look at it. So it's someone who's in that field, and then just to make sure all the information was accurate, and then we would kind of finalize this. We also had a lot of coordination that happened on Slack. So there were these messages that went out where people could say, okay, I'll take up this topic, I'll write about that. If there were changes, so this was a smaller group of people who were coordinating. So as you can see, there were things that had to go back and forth, right? There were mistakes, so things had to go back. So Divya's like saying, okay, like put it back in, we'll try and figure out how to translate it. So Slack was also, at least for daily life, we use Slack a lot to kind of coordinate. That helped. So this is the translation. So Divya and Neeraj and I think Bittu was also involved with the translation. So we did a lot of, we tried to translate in a lot of languages, and they were kind of coordinating this. So some languages were easier than others. So I think like Tamil, Kannada, Bengali, Marathi, it was quite easy. We had a lot of translators, and it was easy to get people to get documents out. There were some other languages that there were always issues with finding people to do it. And the translations happened in 2 stages. So one was there would be someone who would translate it, would perhaps take a day or 2 or something like that. And Divya and Neeraj would make sure they do it in time, and then give them reminders, and that was a whole different level of coordination that they had to deal with. And then they would also send it to a vector who was a slightly more someone they knew. So this is what Divya said. I mean, there was no other way to kind of gauge. It's just, if you know someone is good at science communication and that, they have some familiarity with the language, they would become a vector who would make sure once it's translated, like that everything was kind of in order, and there weren't any use of jargon or other words. So then there was illustration and design. So Ipsa was kind of coordinating this, and she had a lot of young designers who very, during this time, were happy to give their time to kind of do this. So these are the 3 different types of formats that I was talking about. So one is this story. So this is actually, I think, the story about cell V. Then we'd also have an infographic like this, which would be an image that could go out. And then we have a much more detailed write-up about, what do you do when you bring it in. And like I said, this is for it's written for anyone with an interest, but, perhaps the people who are more likely to see it and read it are people who are, in NGOs or activists going out and working. So then there was also more coordination. There were also WhatsApp groups. So, we were using all of this together to kind of coordinate. And then, so once the translations happened, each of the translations had to be put into the design format. So the design was usually done in English, and then all the other text had to be added in the translated text. So that was another level that we had to go through. Similarly for infographics, like once the infographics were translated, we had to make sure that those things were also put into this format. So this, I think, is all on delivery. Got to do this for the detailed information. And then finally, all of this goes up on the web page. So this is, Akshay and his team had kind of set up this web page for us, which was WordPress based. And then we would just make these little boxes and put things in. So this, I hope this plays. So this was a video that I made sort of 1 month in. So this is one of our master spreadsheets that kind of keeps track of what is going where. And each row is one different topic, and the green and the pink are things that are either done, in progress, or yellow is like something's messed up, we have to go back and check it, etc. So this was something I made just because I thought it would be cool to see how this kind of evolves. Hopefully this plays. Okay, it does. So this is from April to about end of May. So just to give you an idea of what kind of timelines. So you see that things get filled in, things on new rows come in, rows get changed. Sometimes things have to be pushed back because there were some errors. So yeah, this is just generally how things kind of moved along. You can also see the different translation, the different languages that we were translating into up here. So I need to go forward. Okay, so then it all ends up on the website. I think Jam already showed you the website. I don't want to take more time, to show you the website. I think if anyone wants, you can go to the website and see it. But if anyone wants me to go through it later during questions, I can do that. And I just want to end with this last thing of what did we learn? So what worked, what didn't work. So one of the things that was problematic was we had. So this workflow that I showed you was sort of unidirectional. There was no way of going back a step, and this became more and more of an issue because either there were updates from research. So, masks, for example, things about masks have been evolving, things about airborne transmission. We had really no way of going back and saying, okay, we need to fix this, right? Because if you can fix it in the English, but then it has to go through all of this other process again before it comes out. It has to be done in different languages, all of that. So that was one part that was we had an issue with. Of course, this is kind of catching errors and fixing it. This we had some system of doing, but it was not really. It was kind of reverse engineered. We also initially had no dates on any of the documents, which we quickly realized was a problem. And then finally, there was there were 3 or 4 different working groups in ISRC, and one of the things was that we were slightly replicating each other's work because the connection between these groups was not quite as smooth as could have been. But yeah, so I just wanted to give you an idea of how this worked and what we learned from it. So yeah, thanks.
Yeah, that was very interesting. Thank you very much. Our next speaker is Professor Pinaki Chaudhuri, who is a physicist working in the Institute of Mathematical Sciences, Chennai, like many of the others in this group. And he is also a part of the ISRC collective and has played a very active role in this effort. So I request Professor Pinaki Chaudhuri to take over and then speak to us about it. Thank you.
Good evening. Can you hear me?
Yeah, we can hear you. Please go ahead.
Yeah, thanks a lot. Yeah. So yeah, it's a pleasure to participate in this online March for Science. So I'll be telling you about the efforts at ISRC on in the context of data analysis and modeling. The work that we did when the pandemic started. So let me just share my screen. So is the screen visible? Yeah. Okay.
Yes, it's visible now. Thank you. Yeah.
Can you? Okay, fine.
Yeah, we can see that now. Yeah.
Yeah. So I'm on the ISRC website, and here's we had a team which was working on this mathematical modeling and data analysis. So it was a group of practicing scientists and also a lot of graduate students. And so the main tasks that we were focused on were one, developing a model which could predict or find out how the spread of the epidemic is happening in the country. And then this was one part of the work, so developing models. The other part was analyzing data from various databases to understand how the spread is happening in the country. And then also the other task was to communicate to general public how these models work, how the data analysis work, and what is the status of research across the world and so on. So let me first tell you a little bit about tracking COVID-19 data. So this is something very standard that many groups have been doing. So essentially, you collect data from databases and then try to plot and see how the number of cases, for example, is evolving across the country in different states. So, for example, here is a dashboard, and this is showing the 7 days rolling average, and this is the status of the epidemic as of yesterday. So you can see how the cases are going up and down in different states, and then you can see how cases are rising. For example, you can see cases rising in Kerala, and then you can from that you can have ideas about how things are going to be in the next 1 week or 2 weeks and so on. So this was tracking data at the state level, and then also one can track data at the district level. So basically, since data is also reported by different states at the level of districts, so you can then also track how the epidemic is evolving in different districts across the country, which district is having more cases at this particular point of time, and so on. So this is effort. I mean, of course, as you can see, the dashboard is still live, and we are gathering data. So at the very beginning of our exercise, it was a bit of difficulty in figuring out how to get data and so on. But thankfully, COVID-19 India database was the perfect answer to this, and we had to find graduate students who could write the scripts which can pull the data, and then having scientists who have the skill set to do the data plotting and so on, so that we could make nice presentation and so on. But the more important thing was that while we were looking at data and so on, we realized that different states were reporting data in different ways. And it was very difficult to have for example, if I want to see how the disease is spreading in the population at the level of different, for example, in men and women, then it was very difficult to find that data for all states. So there are gaps like this in different reporting that is done, and this is well known, of course. And so this kind of data gaps became very clear, and for different things. And then we sort of, this process eventually coalesced to a group of scientists writing publicly to the the central administration that more data should be made available to the general public, so that independent researchers can work on the data, analyze the data, and give help in the efforts to mitigation and so on. So this is about data analysis. So then about modeling, before I go into the modeling work that we did, so I just wanted to say briefly that there were other things, a couple of science communication kind of work that we did. So this was about explaining models of epidemic spreading. So this was important because, you open the newspaper and then you see that X model has predicted this, Y model has predicted that. And this, to laypersons, it's not very clear what this modeling exercise at all means. So we tried to write a primer explaining how this kind of modeling exercises look like, and why do we need mathematical models and so on. And then we followed this up with a question-answer kind of Q&A thing that, for example, at the level of students or more school students and so on, if there are questions like, for India, the graph is showing to be climbing. From this, is there any way to predict when the peak will occur and so on? So these are very simple questions that people ask looking at data, staring at data, be it in the newspaper or other public media. And then we tried to write some Q&As which would help people at large to understand this kind of modeling predictions and to make some sense of it. Otherwise, it's all some scientific gibberish that nobody can make any sense of. So this was the science communication part. And the final thing that I would like to tell you about is about the modeling work that we did. So, so we set up a simple model. This was work which was done in collaboration between scientists at Math Science in Chennai, Savitribhai University in Pune University, ISRC Bangalore, and Ashoka University in Sonipat. So this is a standard epidemiological model that we adopted for the case of COVID, which has this idea that there are asymptomatic patients and symptomatic patients. And then also the important thing is that this kind of models, you can feed in information about the lifeline of a patient through the different stages of the disease, starting from getting infected to probably getting hospitalized, and then either recovery or death and so on. So this is a very standard model adapted for the COVID situation. And the important thing is that we could feed in information about the demography for different states or districts. And we also provide the age-specific information for the demography. For example, you divide the population of Karnataka, for example, into 6 different or 10 different age groups, and you know what is the percentage of population in each such age group. And that is important because the severity of the disease depends upon which population, I mean, the particular population group. For example, we know that the more aged you are, the more severe the disease can be. And then also there is information about contact structure. So it tells that basically you incorporate information about how much there is contact between different age groups, how much there is contact between the old people and the young people, and so on and so forth. Because this is important, because the transmission of disease. So if, for example, if all the young people are affected, what is the probability that the old people would also get affected? So this kind of information can be encoded into the model and so on. And then, so you have a model. So what do you do? So basically, I mean, you can run the model in abstract and get some information and so on. But then also you'd like to make these kind of models useful for local administrations and so on, because that is the aim that we had. And so we tried to do the best possible fit to the available data. So this is using this Bayesian framework, and this requires some large-scale computing and so on. And then, what are the information that you get out of the this model? So the most important information that you get out is the idea that what would be the number of hospitalized or severe cases in the, let's say, next 1 week or 2 weeks. And this is important because this information you can provide to local administrations, and we have worked with several local administrations in cities or states and so on. And this information is useful because then they can plan their infrastructure accordingly. Or you can also design different kinds of interventions, like lockdowns or different kinds of lockdowns. And then the local planners or administrators can figure out which intervention strategy to take up, so that the number of cases go down, or there is less stress on the hospital sector, because that is the most important thing. That how can I have mitigation strategies which would ease the stress on the hospitals? And the last thing that we can also estimate is how much is the case being undercounted. I mean, in all countries across the world, cases are undercounted because only a small fraction of the population is reaching hospitals, for example, or getting tested through contact tracing and so on. And then also, so via this modeling, you can figure out how many number of cases that are actually there in the population, or you can estimate that. And also you can estimate what are the actual number of deaths or fatalities happening in the population. And then you can compare that with the available data or the publicly available data, and you can then figure out what would be the possible undercounting in the number of deaths and so on. So these are the kind of outputs that you get from such modeling exercises. And this was a work in progress. And so, for example, we released our results through a series of reports. So the first report was April 18th. So if you remember, March 23rd, the country went into lockdown. And by April 18th, we had our first set of results. So you can see that, as soon as the lockdown hit us, the team was already in place, and we were able to work out on the models, the basic structure of the model, although that evolved quite a lot over the last 1 year and so on. And then since the country was under severe lockdown, then we were thinking about different strategies of how one can use this kind of lockdowns or ease the lockdown in different cases so that the situation can improve and so on. And then since different numbers were being projected in the media about how the lockdown has affected or mitigated the casualties and so on, we did our own estimate of this lockdown, and would come up with numbers or estimates about what is the possible gain of having such a national lockdown and so on. And then we have done projections for different cities like Chennai, Delhi, and so on. And more recently, just one final thing before I show the. So, for example, so the black data points are the data points from. So this is the number of daily cases that are reported. Again, data, for example, taken from COVID-19 India database. And the blue curves are basically what you get from the model. So as you can see that this modeling exercise can fit the publicly available data quite well. And from such an exercise, I mean, so this is basically the modeling projection that is done till the end of the first wave and not the second wave, which was much harsher. And across the first wave, we could model, we could fit the data, and then we could get estimates about what percentage of the population has been infected and so on. And then you can compare that with the sero-server data. For example, we have done a very extensive exercise for Karnataka and district-wise, and we can do checks on how well our model is working vis-a-vis the serological surveys and so on. And this eventually we have reported in this main archive paper. So people, if people are interested, they can have a look at this modeling, this paper and so on. So I'll stop sharing now. So overall, this was a very useful exercise in bringing people together from different backgrounds with different expertise. And people, I mean, only some of us have some expertise, I mean, some prior experience with working on epidemiological data. But this pandemic brought together a lot of people with different expertises, and we could use that expertise to great effect in helping local administrations to mitigate the local situation and so on. So thank you.
Thank you very much, Professor Pinaki. Our next speaker is from our own group of organizer of the Breakthrough Science Society's efforts in India March for Science. We have R.L. Mauryan. He is the former Principal Scientific Officer in DGQA with 39 years of experience in quality assurance of electronics and communication systems. He is now engaged as a writer on popular science on various subjects and is presently associated with Breakthrough Science Society since 2018 as a convener of the India March for Science for the Karnataka state. Over to you, Mr. Mauryan.
Okay. Good evening, everybody. I will start from the actually that what are the roles science played in combating this effect of corona actually. First role of science was to identify the corona. What is the coronavirus actually? Once coronavirus identified, and second step was how it spreads actually through nasal discharge, person contact. All these things were studied by science and clarified to public in general. Then there was a question. Then a lot of people were dying in China and all over the world, and then nobody knew what to do actually in the situation. Then the question came how to contain it. The scientists suggested simple 3 measures for containment of how to contain immediately. When we do not know solution, how people are getting killed. So they suggested that better to first avoid the measure for contamination, how to contain it actually. In first step in how to contain our physical distancing. I will call, because our Indian media, we have read social distancing. So I discard the word social distancing. I'll prefer a physical distancing. In science, there is more scientific word actually. Second step, the suggestion of science was that how to use face mask. Why face mask required? Because when man coughs, around 3,000 water droplets are released by him, and then they may release another thousands of microparticle sublets that will cause infection. So what science suggested was use N95 masks, which can contain up to 95% of spread. We can contain it. Second was surgical mask, which was suggested by science, again by science, not by layman. Secondly, when the scientists they study structure of that COVID-19, they defined that it is a RNA. It is RNA that virus which has a lipid layer on the surface. Then people thought how to get rid of it actually. It was again science suggested that we should use not ordinary water to dispense with the virus, but use soap water or alkaline water and or alcohol based water solutions, because they can destroy the upper layer of the coronavirus and make it ineffective actually. Secondly, when corona was in the peak and these vaccines have not been developed, and all over the world scientists are working to develop the vaccine. In the meantime, a lot of things were coming in mass media that to how to avoid it. Some was telling that use cow dung, apply in the body. And you may be knowing that man who suggested this method for get to cow dung, he himself died of some time. Some suggested cow urine, some scientists chanting mantras, and some Ayurvedic, this one, Kada was suggested, lighting candles, switching the lights, and conducting puja, Krona Mata, so many things were suggested in the media. So it was again left to scientists all over India to suggest, to fight out these myths actually. So I have listed some of the myths which are already available on India Bioscience Center website. So first myth was that our stomach has got acid, and we should take lot of water, and acid get diluted, and it will fight the coronavirus in the body. But scientific fact is contrary to that, because once we drink lot of water, the acid in stomach get diluted actually, and more so, acid in stomach has nothing to do with the respiratory, because coronavirus in respiratory tracts, our lungs. So it has no link between the two. So it is false to say that drinking a lot of water or the acid in the stomach will destroy our coronavirus. Second point was that Indians are better than the world other country people. It was also propagated in the mass media that we are more healthier, we are more better, so corona will not affect us. Again, it was scientific who suggested that, yes, if you see the fact on the ground, that in the lifespan, we come 128th in the world standard, last. And 7 of the 10th polluting city are in India. And secondly, we are the largest in second diabetic population. So with all the fragilities actually, with this situation, so we cannot say and claim that we are better than in the world. So it was misguiding to say that nothing will happen to us. We will be say we are better than place. Some people suggested that inhaling can steam. The Madam Reeteka has also referred to this point. Inhaling steam. So this has no scientific basis. Inhaling steam will kill your virus, because some people burn their lungs also inhaling hot steams, because the temperature do not kill. We cannot tolerate it actually. So it was again misguidance to suggest that inhaling steam will solve the problem. Another, some people suggested that we should take tea, vitamin C, and essential oil, and that this will cure our this will kill corona in the body. So essential oil, other thing has nothing to this essential oils and the vitamins and tea treated has no evidence that they play a special role in fighting this coronavirus. Next was, some people suggested that we should drink a ginger, lemon tea, honey tea, Indian spice are better, good for that fighting that coronavirus. But let me tell you that these Indian spices may be good for killing bacteria. They may give some immunity to us, but they may give immunity against bacterial infections, but not against the virus. Virus and bacteria are two different things. Both should not be confused by the people. Another thing was suggested was that you should chanting religious mantras. Some people say why mantras can kill, or some say Gayatri mantra. Some mantras suggested, many people misguiding on the website that mantras. But fact is this, the sound cannot kill this virus, and it is wrong to say that mantra will destroy the coronavirus. Third, another myth was that this creating the vibration, like expanding this, if you clap our hand like this, and this vibration will destroy the corona. This is another myth actually. Actually, sound vibrations are very go our ear and then enter the drums. And drums vibration are very small, and they cannot kill the virus, because size of the virus is 1,000,000 times smaller than the sound vibrations. So it is wrong to say that there is no reason to believe that sound vibration or clapping hand will kill the virus. Next person was also another point in media, that we are healthy people, the young people, healthy people. They don't have to take much care. But fact is that in the ground level, if you see that we saw a lot of newspaper, even young people age of 33, 34 getting killed as a effect of corona. And secondly, if you don't take protection, if young people don't take precaution, they may spread the virus. They may become carrier for others, like senior citizens. So it is both necessary that young people also should take precaution, not for themselves but for senior citizens, their family member, whom they can become carrier, can affect their life also. Another thing was suggested was hot weather. It was always in news that hot weather will kill the people. But practical experience show that hot weather. We have seen that in our own country in May, June, July, maximum people died. And why in Italy, in Brazil, where temperature is so high, or South Asian countries where temperature is very high, the virus, we saw thousands of people dying every day with corona. So this is wrong to say that it is a so hot when hot weather comes we will be saved. So these are unscientific things actually. But let me say finally that it is ultimately whenever a crisis in health system has come up anywhere, like plague or that polio or so many health hazards have come to public life. It is only science ultimately which has helped the people to save their life, not the myths, not the pseudoscience. Therefore, we have to depend. Our experience show that our last 2-year experience show that we people have to depend upon scientific evidence, scientific reasoning, and not on the hearsay or whatever coming the mass media just to believe it, or WhatsApp comes in WhatsApp universities actually. And this calls for that ultimately depending on science, the government must invest more money on science and R&D investment, so that in future anything's coming up, then we can save the people's life. Ultimately, that vaccines, whatever have been approved by WHO, they have been not developed in cottage industry or home industry. They have been developed by scientists in sophisticated labs, and then it is proved that it is only science which ultimately can save the life actually. So with this, I end my points. I will not go further. It is not so. I thanks everybody for giving opportunity, sir. Thank you very much.
Thank you very much, sir. So we will put all the panelists on the screen now, and let's field questions from the audience from the places. Yeah, so we are putting them back. Before I take questions from the people listening in, let me ask a few questions. This is really very informative, very exciting thing to say also. So, was there any estimate made about the reach of ISRC's efforts? I know it's an extremely difficult thing to do, but I was wondering, has there any study been done as to, including the number of people who have visited the site, even for that matter? Any one of you. The question is open to everybody. Yeah.
Okay. I mean, like I said, we talked to many groups, talked to scientists, talked to governments, talked to people in different activist groups, and but remember that this was during the time of lockdown that we were starting to do these things, and the social media reach, through WhatsApp and so on reached levels. But I don't think we actually estimated the numbers from that.
Yeah, I could imagine.
Visits,
I was just curious.
had some numbers, but I think the biggest reach was through the people's groups that were doing things on the ground, and what we heard from them about the material that they were using. So it was really only through that. I think that was the
I can imagine.
The multiplicative effect is mainly through that.
Sure. And then my biggest concern about in this kind of situations is that you speak the language of science, which is full of doubt, which says probably there is not enough evidence, etc. And that's the right language. There's no question about it. That's the only language you can speak, and that's the right language. But you are fighting against people who are speaking certainty. For example, even the silliest of things, you inhale steam and you kill the thing. I mean, how do you really handle this? Because it's a really question that I've asked a lot of scientists. Is it when you speak to the people, you already said that you try to avoid jargon, which is perfect. But how do you really find this? Can you share some experience about this? How you modified your language to make sure that people take this seriously?
Yeah, that was always when it came time to finalizing answers, it was always a point of, frequent debates and discussions on that, for the same thing that because the challenge always is to convey the uncertainty. It should not be certainty of this person versus certainty of that person. So I mean, there'll be different views out there, but my view is that we should be certain about the uncertainty, in the sense of like be clear about what we know for sure, but then these are the open questions, or this is why we don't know whatever it is that we don't know. Because as much as important it is to get the right information out there, we also have to identify where the holes are and why the picture is not complete.
Yes. Yeah, I could imagine that too. So this is for Professor Pinaki Chaudhuri, and also the others. There's a lot of bad press for statistics and also for modeling in the general public. It's very unfortunate, because that's mainly because people don't understand what modeling is and what's the purpose of it. It's not that I understand it 100%, but at least I'm open to looking at what it can do for us and I have a bit of an understanding. How have you tried to fight this? Because I'm really appalled by the amount of bad press that modeling gets. I'm really concerned about this.
So this is, I mean, I don't think we have tried to counter it, but we just tried to present our data and also explain the limitations that are there in the kind of analysis that we are doing. I mean, that is the important thing, that we tell that this is what we estimate or what we can say. Because I mean, in the context of modeling, I mean, people were predicting, let's say, 1 month down the line, 2 months down the line, 1 year down the line, what's going to happen. But whenever we are presenting our analysis, we're always saying that we can only tell you what is going to happen in 2 weeks. Beyond that, we cannot tell you anything. And this is the important message that we have been trying to always convey, that these exercises are only good for short-time predictions. And hopefully that message has gone through, but I don't know.
Yeah. So there is one
can I add?
Yes, sure, please.
Yeah. I think it's also, in some sense, not our business to see it as good press or bad press. I think, in the sense that we can only communicate the process, right? And modeling aspect, I mean, when I write F equals MA, it's modeling, right? I mean, there is all kinds of modeling in science. And when you talk about statistical and data, and looking at data as it comes in and interpreting, science has its problem. And on the other hand, epidemiology has had enormous success based on models of this kind. So we can only talk about the successes and the uncertainties that we live with. And I think that process of science is what we want to communicate as much as possible repeatedly. So I think, and whatever, it gets. And this is the challenge of science communication to me almost all the time. So
yeah, that's much appreciated. That's what needs to be done. That's the only thing that you can do, actually, in fact.
I'll just add one more point. And the other important thing that we have been trying to emphasize is that, I mean, always look at all these modeling exercises. There's feedback somewhere. Anyway, so there's all the modeling exercise should be done at a very local scale, at city level, at district level. It's not any meaningful to look at any exercise that is done at the national level, because you are aggregating all kind of fluctuations that are happening and so on. And the only meaningful exercise that you can do is at a city level or even a sub-city level, because you have control over the information that is coming in, and also you can devise strategies at that scale. And this is something also, I mean, whoever has been speaking on behalf of the modeling group has been trying to emphasize on this point, or also in our work reports that we have been taking out.
Yeah, I can imagine. Yes, thank you. So there is another question from one of the listeners. It's not directly connected with the subject of what we have been talking, but how many variations of the virus is there around? Do we know? Because we have been hearing about alpha, beta, lambda, and stuff like this. Is there any number? Is it something that we can really know? Anyone?
We only know about the ones when there's a change in the.
No, I have.
So, I mean, there is 4 recorded so far where there is a change in transmissibility or its response to the antibody, but that's not to say that that's the only number there is.
Yeah. That's what it is.
Yeah.
Okay.
But as may speak as per the data available in the net, they say that nowadays that delta plus, the latest variation, alpha, beta, and delta variation. These are the variations that have come to market now. It's already available in the website.
Yeah.
Right.
Right. I think that with that we come to the end of the questions from the audience. If there's anything that we should wait, or no, I think we're done with the questions. So on behalf of BSS and India March for Science, I thank all of you, and we really appreciate the phenomenal amount of effort and sincere efforts, more importantly, that has gone into ISRC. We are really proud of that. And thank you very much for your time and effort in presenting your work in today's evening's program. On behalf of all the listeners, BSS and IMFS, I thank you very much. With this, I think we could conclude today's program. Thank you.
Thank you.
Thank you all.
Thank you. Yeah. All right.
Thank you.
Thanks.
Thank you.